Even though I have all these degrees, and even though I am the CEO of Methodist Labrana Healthcare, and even though that it feels like I've accomplished quite a lot, life wasn't always this easy. Before I move on, I am pretty sure that some of you are wondering how to pronounce my last name. So, if you must know, the name is Ugwueke. So let's do a quick tutorial. I want you to repeat after me. Ugwu. No, you got to do better than that. Ugwueke. It's not that difficult. So Ugwu means respect, and Eke means from birth or from ages. So you can easily say that I've always demanded respect since birth. As a young kid, 8-year-old kid growing up in the eastern part of Nigeria, just in case if you're wondering if this Orange Mound accent. Life was relatively normal until that fateful day in 1967 that a civil war broke out in the country. Everything completely changed. My life was completely turned upside down. We became refugees, moving from one refugee camp to another refugee camp. The war broke out because the people from the southeastern part of Nigeria were being marginalized, and they attempted to secede from the country to create their own country called Biafra. In that refugee camp, my younger brother got sick. He had diarrhea, couldn't retain fluid. There were no doctors and there were no hospitals to take care of him. I literally watched my 1-year-old brother die right before my eyes. At that moment, I made a decision that I wanted to be a medical doctor. During the war, death was everywhere. Witnessed a lot of carnage. Kids were starving, malnutrition. And the war ended in 3 years. Over 2 million people died during that war. After the war, I went back to high school, trying to complete school, trying to assume normal life. As you can imagine, what a normal life looks like after a 3-year civil war. The war motivated me to study hard because I wanted to be a medical doctor. While I was studying, I wanted to go to school in the West. So I started applying to schools in Europe, England, and the United States. I also knew that there would be lots of challenges relative to financing. I decided to apply to schools that have relatively low tuition. I found 3 such schools. One was Shaw University in Raleigh, North Carolina. The second one was Marshall University in West Virginia. And the third was St. Edward University in Austin, Texas. During that time, those schools' tuitions were about $4,000. Applied, got accepted, and now the problem started, how to raise the funds. I was working, trying to raise some money, begging family members and relatives trying to raise some money. It took me close to a year to raise 2,000 naira, which was equivalent of about 4,000 American dollars at the time. Finally raised the money, took my papers, went to the American Embassy. The visa attendant asked me, which school do you want to go to? So I gave her my 3 letters of admission, and I asked her, which school should I go to? She took a look at it, and she said, if I were you, I would go to Shaw University. To which I said, why? And she said, it's in the South, the weather is nice, you will like it there. And that was how that decision was made. On January 4th, 1980, I landed at JFK International Airport, connected a flight from LaGuardia to Raleigh, North Carolina. At Shaw University, I enrolled in pre-med biology, obviously with the hope of going to medical school. Took odd jobs to pay tuition and maintain myself. I was in a hurry, wanted to finish school so that I can go back to Nigeria very quickly. I graduated in 3 years and realized at that time that I've come to the end of my rope. With no money, the opportunity to go to medical school became a distant dream. I was upset, confused, didn't know what else to do. In fact, I was considering just going back to Nigeria and abandoning the whole dream. And then the military coup of 1983 happened in Nigeria. I had no other choice at the time. It's been said that when one door closes, another door opens. Unfortunately, we're too busy staring at the closed door hopelessly. As I was debating my options, one of the professors at school suggested the School of Public Health and said as an alternative, he said, although the training is a little different, I think that education will help you ultimately when you get back to Nigeria. So I applied to schools of public health. I was accepted at Emory. I decided to go to Emory in Atlanta. During my first year at Emory, I took a course in community health. That course completely changed everything I know about Atlanta. It exposed me to parts of Atlanta that I did not know existed. Pure, abject poverty, lack of quality health care, all imaginable health incidents that is caused by what we now know as social determinants of health. So what is social determinants of health? They are the conditions in which people are born, live, grow, age. They are the conditions that are causing all the issues relative to diabetes, hypertension, heart diseases, and even some forms of cancer. Also realize that even in a city like Atlanta with abundant supply of doctors and hospitals, poor people were still dying hopelessly. It dawned on me at that time that the same conditions that I saw in Nigeria that were really driving my passion to come to the United States to study so I can go back was literally staring at me at that time. I decided that I didn't have to go to Nigeria to make a difference. I can start right here and right now. So after completing my master's in public health, my focus started to shift towards looking for ways to truly begin to improve community health. I also started working in hospitals in Atlanta at the time, and then realized that most of the patients that we were seeing in the hospital, some of their conditions could easily have been prevented if they took better care of themselves. Which brings me full circle to where we started this conversation. Are hospitals really responsible for your health? We know that our health, 80% of our health is determined by non-healthcare related conditions such as socioeconomic conditions, environment, health behaviors. Those are the primary causes of health issues. So let's take diabetes as an example. We have now become the most obese country in the world. Almost 40% of our citizens are classified as obese. In fact, we have gone from being about 15% obese in 1970 to almost 40% today in 2014. So we do know that two things contribute to obesity, or things we could do to mitigate obesity, and that's exercise and diet. Those are truly within our control. So let's take exercise, for example. So we know that an average adult, 18 and above, walks about 4,000 to 18,000 steps a day. We also know that it takes 10,000 steps a week to lose 1 pound. So my ask is, regardless of what your routine is, if you're not doing up to 10,000 steps a day, maybe, just maybe, you can start by increasing whatever your routine is by additional 500 steps. It can easily be done. You can, in fact, do it just by walking around your neighborhood or around the block of your house. So the second item that contributes to obesity, obviously, is diet. And we too know that we have become one of the highest consumers of calories in the country, in the world, actually. So, knowing that, and also we know that we have gone from 2,800 calories a day in 1961 to over 3,600 calories the year 2013. We also know that it takes about 3,500 calories to burn 1 pound of fat. So what I'm asking is, if you can cut down the caloric intake just by 250 calories and maybe increase your exercise output by additional 250, burning additional 250 calories, we can truly begin to shape our physical health. And we know that over time, caloric intake coupled with exercise and compounded over time truly improves the overall health status of individuals. So as I was thinking through all of this, it dawned on me again, as a country and as a society, we wait till every new year to make a decision and make a resolution. We're going to live healthy. I'm going to exercise. I will watch my diet. And by February, the goals are broken. Why don't we just change that thinking a little bit? Instead of waiting till every new year to make those decisions, how about if we think of it and think of any new day as a new year, so to speak? So as you wake up the next morning, consider that your new year, your new day, and begin to adopt some of these changes that we're talking about today, so you don't have to wait till next year to get to the point of exercising or watching whatever you eat. In fact, if you just want to watch what you eat, I don't know how many of you drink soda, but just eliminating one can of soda, it's about 150 so calories. And that compounded over time results in better health. Before I close, I'd like to summarize with a small story about a friend of mine named Robert. Robert is in his late 40s, married. Robert has 2 adorable daughters. And Robert has a history of heart disease in his family. One day at church, Robert went to a health fair that was conducted by a local health system in the community. They took his blood pressure. His blood pressure was extremely high. It was 200/100. They obviously told Robert to go directly to the nearest emergency room. Robert went to the emergency room, and they gave him medication to stabilize his blood pressure, and also told him that he needs to go see his doctor. Robert went to see his doctor. The doctor did all the physicals and came back and said to Robert, unfortunately, you have to make some drastic changes in your life. One, to reduce weight so you can reduce your cholesterol, and by the way, you're borderline diabetic at the same time. Robert took that message very seriously and started making some changes in his life. Unfortunately, there are a lot of Roberts out there, and even in this room, as a matter of fact, that will hear some of those messages and literally do nothing. So to paraphrase the Chinese philosopher named Yang Ting, to know and not act is tantamount to not knowing at all. Now that we all know, let us go and act. Thank you.